My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
New Year. This is Norm Volsky for the Digital Health Heavyweights podcast, and today we are thrilled to have our guest, COO of Transcarent, Snezana Mahon.
Hi, good morning, Norm. How are you? Happy New Year.
I am great. Happy New Year. How are you?
Fantastic.
Excellent. So really appreciate you spending some time with us in early January. We're actually not going to release this episode until late January, but very excited to have you. For all of you that don't know, Snezana, currently COO of Transcarent, working with Glenn Tolman and crew. Before she joined Transcarent, she had long tenures at both Express Scripts and Evernorth in the PBM world. She's a pharmacist by background, and she's sat in positions including vice president and general manager of care solutions at those two groups. So I'm really excited to have you on the show, and always love having a clinician on. So, I guess my question is this, Snezana. What inspired you to get your Pharm.D and to work in healthcare?
My passion for healthcare really goes back to even childhood. I always wanted to do something in healthcare, whether it was being a physician, a pharmacist, and actually back in high school, I excelled in science and math. And I always said I want to pursue either a medical degree or a pharmacy degree. And one summer, I ended up doing a pharmacy internship as a technician at Walgreens, and I just fell in love with the profession of pharmacy. And I got to see firsthand what point of care delivery really was and the challenges that patients and consumers are facing when obtaining their prescription drugs. And knowing that the prescription drug benefit is the single most utilized benefit in our country today, where 8 out of 10 Americans are using at least one medication or more, I knew it was something I really wanted to be part of. And so I entered the space of pharmacy, went and got my doctorate in pharmacy, and then sort of continued my journey as I have both in the retail sector, in the direct care delivery, as well as on the pharmacy benefit management side, where I had the opportunity to impact millions of people's pharmacy care. So
I love it. What inspired you to leave traditional retail pharmacy and move over to the PBM side and work for the big Goliath that is
the big Goliath? There were a few reasons for that. When I reflect back on my time as a Walgreens pharmacy technician, intern, and pharmacist, I was able to take care of 500 patients per day. And what I was seeing is there was such an opportunity to impact that in a broader scale. And so I'm based in St. Louis. Express Scripts is based in St. Louis. And I thought, why not try to join sort of a bigger institution that is impacting hundreds and thousands and millions of lives. And so joining Express Scripts, I really wanted to fix and work on the problems that I was seeing firsthand at the pharmacy counter that members were experiencing. Issues with people showing up at the pharmacy counter, not understanding how much a drug costs, why they have a prior authorization, why their doctor is writing for a brand when there is a generic, not understanding the differences, the pains of prior authorizations, working with providers, getting clinical criteria. I just kept telling myself, there's got to be a better way. And so I went on the PBM side, working to fix the problems that I was trying to solve for members across the pharmacy counter. And what better place to join than Express Scripts, servicing over 100 million members. And that is what I dedicated my career to, 13 plus years, really working on challenging myself and my team to fix those things that I was seeing at the point of sale while being a clinician on the front lines.
What were you most proud of the time, 13 years spent there? What are some of the changes that, you helped to precipitate?
Yeah. Oh, there were so many. I just had an incredible career at Express Scripts. I started out in the Medicare segment of our business, supporting our Medicare, Medicaid, exchange eligible members. And one of my proudest moments there was building a star ratings program that was helping our Medicare Advantage health plans achieve 4.5 or 5 stars, focusing on all the clinical outcome measures, the administrative measures, getting access to care. I was really passionate about Medicare as well as compliance and helping all our clients successfully pass all the CMS audits. Those were, I would say, some of the highlights. Some others, because I had so many, I felt like I spent a long time with one company, but I had so many different roles and functions in that time. Some other highlights were launching some incredible clinical programs. I was really proud about the launch of our Health Connect 360 program, our advanced opioid management solution, in the height of the opioid epidemic in the U.S. So there were a number of examples where my team and I worked on some really innovative solutions that were helping both our commercial self-insured employers as well as our Medicare Advantage health plans thrive and innovate in the healthcare space.
I love it. You moved up the ladder pretty quickly at Express Scripts.
Yes.
So what tips would you give an up-and-coming professional on how to rise up through the ranks and succeed the way you did?
Yeah, never say no to an opportunity. When I reflect back on my career, I was a young pharmacist that entered the organization. My first job was to be a senior manager of Medicare. I didn't know anything about Medicare. The Medicare Modernization Act had just come into play. And I was just so focused and dedicated on learning every single memo, becoming a subject matter expert. And so once I became a subject matter expert, you sort of build yourself a niche that then people can rely on you. And it sort of led to the next opportunity and the next opportunity. So then after that, somebody said, "Hey, do you want to lead people in operations?" I'm like, okay, like I'm a clinician, but sure, I'll try that.
Yeah.
And so I challenged myself to new things. I didn't say no. Then after that operational opportunity, I was given the opportunity to like, "Hey, you're so great at the subject matter expertise. Why don't you go into sales? Would you like sales?" So then for 3 years, ever been in sales, went in, right, toured the entire US from Helena, Montana to, Appleton, Wisconsin to Miami to New York. I really got to see where health plans and employers were and how they were trying to deliver care. And I learned so much from that. So these examples of try new things, challenge yourself, that has really led me to today. When I think back of, I've had roles in product and clinical and operations and sales that has helped me sort of be the operator and sort of that strategic thinker that I'm at today. But none of that would have been possible if I said no to any single one of those.
Yeah.
And sometimes you reflect back and you sort of see the puzzle pieces that came together, that really gives you the perspective that you have to drive change, and in particular in health care, that's so important. So.
All right. I love it. I have to shout out, my personal hero, Jerry Garcia. What a long, strange trip it's been, for you and your career, but it all, worked out fantastically. I really love what you said, because I think a lot of times, people look back on their career, they have some regrets, and it usually has to do with, them not believing in themselves enough.
Totally.
Like, you were given opportunities, and it was because other people believed in you. And luckily, your personal belief in yourself gave you the confidence to do something that you haven't done before. But if someone else thought you were capable of doing it, you weren't the one stopping them from, saying, "Hey,
100%.
you should do it. I believe in myself. I'll figure it out." So I really, encourage our listeners to really think how many things they've turned down in their career, and how much of it was imposter syndrome, how much of it was other people thought you were capable, but you didn't. And the people that have a lot of success, the people that reach the top of their profession, a lot of times, people feel they're capable, but more importantly, they think they're capable, and they take some risks that many others don't. So I really just love the way, you described that. It's fantastic. There's a very common complaint in digital health that there's not enough clinicians in the field. It's all people who are tech people that don't know like what it's like on the clinical side, and we don't have that perspective. So can you walk us through how you feel your Pharm.D has really helped you as an executive, in this like very niche, very high growth area that we call digital health?
Absolutely. I mean, I couldn't agree more with you. you can't fix healthcare unless you come from healthcare. You sort of understand
Mm-hmm.
what's really broken, the fragmentation, the complexities, and having that clinical mindset on two fronts: clinical knowledge and clinical experience of having that bedside sort of care, whether you're a physician or a nurse or a pharmacist. You understand what the consumer that you're trying to help with, whether it's a digital tool, a human-led tool, whatever it is that you're delivering, how are they going to respond? What questions are they going to ask? And one of the things that I learned in my early career, being a pharmacist, is the challenges of health literacy. The things that I was seeing on the front lines across the pharmacy counter, where a mom would be coming in and you're giving her an antibiotic suspension for ear infections, and she's putting it in the ear of her child, not understanding that you take it by mouth, or
Mm-hmm.
people eating their suppositories, or people not understanding the level of health literacy, right? How do you democratize knowledge? How do you drive that? And so, as a clinician, right, the way we even position information in a digital experience, how are you focusing on accessibility? Are you thinking about alternative languages? Are you trying to? And so, that clinical mindset is crucial for organizations, not just to launch a product, but to launch a product that people will use, that people will love, and that people will want to come back to.
Mm-hmm.
And so I tell individuals all the time, as they're trying to build organizations, surround yourself with clinicians who have had firsthand knowledge and experience, not just by textbook, but actually interfacing with the people that you're trying to deliver the care to, because that is the ultimate sort of experience that you're looking to design. And I would love to see many, many more clinicians, pharmacists, nurses, physicians in the digital healthcare space, because it's so important. And in particular, the profession of pharmacy, and having more pharmacists, because as we think about in the future, the cure is in our genes. When we think
Mm-hmm.
about our gene therapies and other cures that are coming on, that is what excites me. And I challenge a lot of young pharmacists who are either in school or getting out of school to say the future in pharmacy is bright. It's not just in a retail pharmacy setting or a hospital basement pharmacy. There's so much you can do with your degree. And yeah, really excited about what digital health and pharmacy can do over the next coming decade.
So what would you suggest people with that background, like what should they do? Like how do they go
Yeah.
seek out like their next potential career?
Yeah, look at opportunities. I mean, when I reflect back, in the late 90s and early 2000s, when I was getting into the pharmacy care space in school, they were only teaching us two things. You can go into retail pharmacy or you can go into hospital pharmacy.
Mm-hmm.
Since then, there's been an explosion of opportunities, right? Working with pharma in pharmaceutical informatics, and looking at digital health companies. There's 300,000 startups. And so open up your aperture to say, where can a pharmacist have a position? Now you have employers who are hiring pharmacists in their HR departments, like
Yeah.
running their benefits team. And so, where we used to traditionally think the profession of pharmacy could only sit in, pharmacists have now entered every sector of care, and even other places like in the finance sector and other things where employers are really trying to drive that benefit. So I challenge people to say, seek out opportunities, build out new segments for yourself in our profession of where we can play a role, and don't just get pigeonholed into sort of the traditional segments of pharmacy that most people think of.
Yeah. That's really, really great to hear. Great advice. I'm a big proponent. I've been in this, employee benefit space for now 8
Mm-hmm.
plus years.
Yeah.
Interestingly enough, like Glenn and Livongo was
Yeah.
my first client in this employer market. I came from the hospital
Okay.
software world and found, Livongo, and I said, well, I love working with them and I love, the
Yeah.
type of work they're doing. I want to work with more companies like that. And I've
Yeah.
been sprinting towards this ever since. And I'm really glad I did. But what I think is the one like unaddressed area of digital health that like hasn't really been solved yet, that I think is like the biggest opportunity out there: clinical pharmacy. Like unless
100%.
people are taking pharmaceuticals that make themselves feel better, not worse, then you're going to have a really hard time managing a chronic condition that way. So I think there's a
Totally.
lot of people suffering in silence from side effects or drug interactions that is a massive opportunity in the market, and no one has yet solved for it, at least to my knowledge. So really excited to see that over the coming years. What would you say your greatest learnings were from working at Express Scripts all those years?
Oh, I had so many. I mean, when you think back, my learnings were that to build quality product, you can't take shortcuts. You really have to do it right, because consumers are depending on it, patients, and probably, my start in Medicare, right? CMS sort of governing everything, managing everything. I've taken myself to those standards, to the highest levels of standards, to say if I launch a product, I build a product. If it works for Medicare, it's going to work in commercial. So kind of taking those learnings and taking your time, thinking about all aspects, is really important, that I've carried with me. Even now at Transcarent, it's how we think about product design, launching solutions. The other thing I've learned is always think about how are you going to scale something. Don't just build something in hard code solutions because it's going to be good enough to sort of crank it out. How do you think about the big picture? How do you think about how you're going to scale something a year, 2, 5 years from now, and build it with flexibility and agility in mind?
Hmm.
Because that's going to be important. Know that customers want customization, like in today's world, to think that a standard sort of output is going to be good enough. You've seen one employer, you've seen one health plan, they all want something different. And so kind of going out with that mindset of customization, flexibility, and focus on the highest quality are probably some of the biggest learnings that I've taken away and that I continue to apply in as we're building out our business.
All right. I'm going to skip back actually to what we were talking about, Tad, earlier
Yeah,
around, having clinicians move into more digital health
yeah,
companies. I guess here's my question. How do we incentivize them to do that? Because I think there's a group, whether we're talking about PharmDs, whether we're talking about nurses, whether we're talking about doctors, this is oversimplifying it, but there's two types. There are the
uh,
people that just want to care for patients. Like that's their mission. They would do it for free if they wanted. And then there's the group that again love doing that. That's a big part of why they chose it, but they also love the like stability and the
yes,
financial upside
yes,
and like, again, stability,
uh-huh.
high salary of like a clinician job, whether that's doctor, nurse, or
Mhm.
pharmacist. My question is how do we incentivize people who might be more risk averse to join something that inherently is more risky?
Yeah, I think about that often as I challenge my friends, my colleagues who are in the profession. Now that I've taken the leap of faith, I used to be in that other camp of most clinicians, right? Very type A, traditionally, like very focused. You don't take risk. You're sort of very, very conservative. And now that I've sort of stepped out on the other side and I've seen what startup culture is like, helping people understand that the same mission and passion that you have for care delivery can exist in an environment where you're really focusing on transforming healthcare for the betterment, right, of health and
Mm-hmm.
care, instead of just focusing on, right, you work for publicly traded companies, right? It's very, very much aligned to posting earnings, like focusing on margin, driving those, which is all great, right? I'm all for profit, for the ability to do that. But you can literally do what you do in clinical practice and apply that in a startup sort of environment, where every single person that you're working with there has the same mission sort of driven mindset to fix the things of where they've come from, what they have experienced. And so I see so many similarities, but you don't know or you don't understand unless you're sort of in it. And so I'm constantly challenging people to say, give startups a try.
Yeah.
Sort of the mentality that um, nothing quite works yet, right?
Yeah.
Especially in the early seed, Series A, Series B, right? It's sort of like this, just try to figure out how to make something work. It's the same kind of fight or flight mode that most clinicians are, in intense situation. You're working in the ER, in the ICU, that same adrenaline sort of that you're getting in trying to make rapid, quick decisions. You can apply that in the startup space. So I don't know that it's so much as incentives as it is to just awareness and education. Like,
Mm-hmm.
while there are so many startups in the US, there are so few people that actually understand like what the opportunities are, the type of people that can work there. Because where you started off with, typically people think of startups as Silicon Valley, a few ex Google, ex Microsoft, ex Amazon people that have gotten together to
Mm-hmm.
sort of try to fix something. the opportunities are abound and immense. And I think the more word we can spread, people who are working in the startup world, as I'm trying to bring more friends sort of across the chasm, that is what we need to do, to say it's not as scary as you think. You can still make a good living. Don't worry about
In many
that.
cases, better.
Better, right? I mean, long term, if you're invested and you want to make the right decisions, you're going to be better off. Like, so really
Yeah.
kind of comparing and contrasting the short term versus long term. Yeah, sure. There's the safe bet of every year, right? I'm going to collect salary. I'm going to collect the bonus. I'm going to collect the stock option. But there's so much more that you gain from a personal growth, experience, challenging yourself. Most important, working in a culture
Yeah.
of people that are all like-minded, focusing on fixing the things. So that's what I would say.
Really think that's insightful. I guess bad for the healthcare system, good for the clinicians. There's still,
Yeah,
there's a shortage of them. So
yeah,
God
totally.
forbid someone makes the jump and they want to go back. Good news. Like every company's
Yeah.
hiring, for those things.
Yes.
So,
Yes.
the risk is always a lot less than is perceived. So speaking of, Express Scripts, Evernorth,
Yeah.
huge company, very stable. Transcarent, again, different risk profile.
Yes.
We all have all the belief in the business and Glenn and the whole leadership team, but that was a risk for you. That was a jump for you. What made you feel like it was a worthwhile risk?
Yeah, I get that question often, specific to the why, right? You had
Personally,
an incredible
professionally, or
growth.
both?
Both, right?
Yeah.
People will ask, just curious, right? You were at the top of your career. You worked for one of the biggest PBMs in the country. The why. There were a couple of reasons for the why. One is I really felt that my job of sort of why I even entered into pharmacy and why I went from retail to a big PBM of fixing, solving solutions for the patients I was taking care of. Today, 20 years later, right? People still at the pharmacy counter don't have full transparency of what a medication is costing or how they're taking it.
Mm-hmm.
Physicians are still fed up with the way prior authorizations are being handled, the information that they're being giving. And I looked back and I said, okay, I've made a lot of progress, incremental progress, but I still have not solved all the things that I was experiencing as a pharmacist on the front lines. And I felt, why not? As I think about the next 20 years of my career, I know that there's so much work to be done. Our healthcare system is more complex, more confusing, and more costly than ever before. And so when Glenn Tolman reached out to me, and I knew Glenn, from my time when he was at Livongo, I was at ESI, we worked very closely together. And Glenn was like, look, I need you to come and join me on this mission because you understand healthcare, you understand health plans, you understand employers, you understand how to be an operator. How do we build something that will get that consumer directed care in a different way for when they're healthy and when they're sick, not just sort of operating in a sick care system, but really focusing on that healthcare system.
Mm-hmm.
And that's really what drove me, is that my personal mission of sort of is still not done. That until every single patient understands how to take their medications, what it's going to cost to take their medication, what questions to ask, where to get quick help. And having some of those self-help tools are really important. And that's why I joined Transcarent on this mission to deliver the one place for health and care that makes it easy to access high quality, affordable care. And I'm not going to stop until we deliver that. So
That's fantastic. I love when people are truly inspired and really passionate about what they're doing, and it's beyond obvious why you're in it. So I really like that. How has Transcarent's offering over time evolved in terms of member experience?
yeah, gosh, we have invested so much as an organization. I've now been with the company for almost 2.5 years, and the evolution has been immense. We started off as a surgical COE company that has then evolved into, we started in the complex end of care and sort of have transitioned more into the lower acuity side of care across the entire continuum. We now offer 5 different types of care experiences, everything from everyday care to care at home, to pharmacy care, to oncology care, behavioral care, and then sort of this longitudinal surgical care, everything from musculoskeletal care and on, as we think about centers of excellence. And we're committed to continue to expand until you're getting to solving for all of the consumers' health and care needs, whether it's in their day-to-day sort of needs to when they're in the most complex situations, like getting the words of you have cancer. How do we support you across that continuum?
And in terms of like what inspired the creation of Transcarent, and like how does it aim to reshape the healthcare experience for the patient? Can you just walk us through that piece?
Yeah, I mean, a lot of it is driven by our CEO, who most people know, Glenn Tolman. What drove him to really build Transcarent, even in the name, right? When you think about transparency and care enablement and empowerment of the consumer, how do we truly deliver consumer-directed care, but beyond just digital health? There's so many digital healthcare companies, but what we have realized is consumers want sort of that hybrid care. They want local care, they
Hmm.
want virtual care, but they want care on their terms. And
Hmm.
so, giving that flexibility and a portal and a platform and an ecosystem that will surround the member of no matter where you're at. And especially coming out of COVID, where employees for many large self insured employers have moved all over the country,
Hmm.
their care needs have evolved. And so, our mission as an organization is really to deliver that one place no matter where you're at, and
Hmm.
you should be able to access it virtually in your home or in a local care setting. And that's why we continue to expand both in terms of our partnerships with health systems in being able to provide that local care delivery, as well as servicing more globally, sort of expanding that self-service tools and the virtual, care delivery front within our digital experience.
How do you see the company maintaining a member-centric focus, and what kind of impact can members expect, in their healthcare experience of the future?
Yeah, it goes back to being the one place. And our number one mission is to be the most loved healthcare experience app that any consumer has ever seen or experienced, right? When you
High
think back
bar.
to other apps, yeah, that consumers love. When you think about when you walk out of an airport, right? Do you go in a taxi line, or do you go pull up your Uber or your Lyft app? You do that. When you're trying to book hotels, right? Do you go to Airbnb or do you do that? How do we make it easy for us to be the right choice for
Hmm.
consumers to say? And that's why we're focusing on this experience. It starts off with everyday care. How can you text and chat with a physician within 60 seconds? And we guarantee it for our clients that it's 2 a.m. in the morning. I'm a mom trying to dose Tylenol for my child. How do I do that without
Hmm.
having to go into the ER? The more you make the experiences easy to use, reliable, and dependable, the more the consumers are going to come back. And so we're investing in that. Second, as we're thinking about medications, right? What I'm passionate about as a pharmacist, how do we deliver the lowest possible cost of medications and informing the consumer of where to get that information, right? There's Mark Cuban Cost Plus Pharmacy, there's other home delivery pharmacies, there's retail pharmacies. How do I give you that optionality? So instead of you having to search on Google and pull up your own coupons and download them and call your contact center of your PBM or your health plan, let us do the work. Let our
Hmm.
tools search for you, right? Every 60 seconds and say, quick alert, text message. Did you know you could save $300? Click here, click, done. Prescription is in the palm of your hands. How do I get you access to care at home? Maybe it is a Sunday morning and you need, you don't want to go to the urgent care between the hours of 8 a.m. to 10 p.m. You can click a button and we'll get a urgent care delivered to your home, right? Somebody
Hmm.
will come in there, get your vitals, get your fluids. So the way we think about the consumer experience is challenging ourselves not against healthcare standards, but
Hmm.
challenging ourselves against other consumer centric standards, right? In the banking industry, in the beauty industry, in the food industry,
Hmm.
right? Transportation industry. What consumers have grown to expect and love is what we want to bring to healthcare. And that's where Transcarent is really focusing. And that on demand care, truly on demand, 24/7, 365, being on, being available in whatever way you want to communicate, whether it's text, chat, call, video, we're here for you. And that is how we plan on expanding and growing with our member base.
AI is all the rage these days. How does Transcarent use predictive data to achieve higher utilization? for members?
Yeah. Oh gosh, data is so important, and AI in particular is just going to transform the way any of us, conduct our day-to-day business. What's really unique about us here at Transcarent is that focused on getting access to a number of different data pieces. Historically, the industry is right had an over reliance on pharmacy claims data, medical claims data. Well, the reality is that all of that is retrospective, and you can really act on it when you think about next best actions. And so what we're doing here at Transcarent is leveraging that personalization engine of the patient self-reported data. Because the members are using our experience so much and they're loving it, they're sharing a lot of information about their needs, their wishes, their wants. And so how do we use that to build better models and inform models to be able to proactively serve up opportunities for members and instantaneously, right? When you think about how we're training our AI models to even be responsive in a moment, like somebody pulls up to chat with a physician in the virtual care experience, they can literally start typing in Vietnamese, and we're able to continue responding back to them. That is the power of sort of understanding the models and accessibility and solving for all the issues that I discussed earlier, right? The health literacy problems that we're having and other elements, using the AI models and providing information front and center, giving that trusted guidance to consumers. And that's really what we're enabling. So everything from early identifications to truly identifying next best actions, and the usability of the tools is what AI is going to empower in what we're doing here at Transcarent. So really excited about the future and what it holds and what we're going to be able to deliver for our clients and our members.
I imagine the next thing I'm going to ask you about, you have your fingerprints all over. Walk us through Transcarent's PBM solution.
Yeah. So from a PBM perspective, as I mentioned before, super passionate about this space. What we really wanted to set out to do is to solve sort of the three big problems that employers are facing today in the PBM. The largest problem is sort of the global lack of transparency and access to information and data. As an employer today, that they're hearing from their members to say, wait a minute, you've given me this lovely pharmacy benefit, but how come I show up at the pharmacy counter and I look up on GoodRx or somewhere on Google, this medication is $10 cheaper than what you have given me on my pharmacy benefit. And so employers really want to be able to have that access to greater transparency for their employees, as well as for themselves, of what a benefit actually should be costing. Second, having greater alignment around truly what is being passed back and shared with the employer, passing back 100% of the rebates, not holding on to them, ensuring that audit rights, full access to data. You don't have to pay for it, right? Too often, going back to your earlier question about the data, that is right now becoming a bottleneck where organizations, unfortunately, are not willing to share information, right? Whether it's medical carriers or point solutions or PBMs are not willing to share the client's data with them in order to coordinate that care. We feel it's really important to be an entity that is able to enable that care coordination versus sort of in the prevention box, and being able to deliver that for employers. And then most importantly, integrating the pharmacy benefit with the other benefits, the medical benefit, the surgical benefit, the point solution benefit. And so what we have designed in our pharmacy care experience is, instead of having we adjudicate and reject your claims over here, then we do your medical claims over here, and then your behavioral health is over there. How do you allow a consumer that the physical act of having to take a medication is going with you as you're dealing with your behavioral health issues, as you're trying to prep for a surgical episode, as you're trying to do that? So inter sort of winding the pharmacy benefit with the other benefits. And we've done that in our digital experience. And that's really what's unique about our offering is, think about the next generation of integrated pharmacy care delivery that gives you the transparency that both you as the consumer want and the employer demands, as well as getting a much better experience than you typically would get in a traditional sort of pharmacy benefit.
I love removing the different silos and just integrating all into one. I'm sure is going to create a much, much better experience, for the patients. So walk us through, how Transcarent's partnered with Prescriptive, GoodRx, and Mark Cuban's Cost, Plus Group plus Walmart.
Yeah. One of the big, hopefully, as you're starting to sort of see a theme at Transcarent is we believe that to fix healthcare, you need to partner with some of the best in the industry who specialize in key niches. And instead of just focusing on sort of what you tend to see in the industry, a lot of the vertical integrations where it's more of, a health plan that owns a PBM, that owns a pharmacy, that owns certain elements. How do we start expanding and sort of opening up the network instead of closing the network, opening up the network of opportunities and possibilities by bringing whether it's a Mark Cuban Cost Plus or other home delivery pharmacies or like a Walmart or like a GoodRx to be powering the health and care experience that helps members get the best possible care at the best place from a sort of quality delivery standpoint at the best price and making it easy to get that information. And one of the ways we're doing that is because we're fully aligned. The only two parties we're ultimately aligned to is the payer of the care, which is the employer, and then the consumer of the care, which is the patient or the member. Yep. And that is our mission, is giving them more access to these places that are delivering these incredible care experiences. And then we're enabling them within our singular one place platform to be able to do that.
All right. Well, we love breaking news on this podcast. Yeah. So please tell us about Transcarent's new weight health solution and why you're excited about how it can impact patients and the market in general.
Yeah. I am super excited about the launch of our weight health solutions for a few reasons. So what's happening in our country today? Today, over 43% of the U.S. population is considered clinically obese. That has a BMI of over 30. By 2030, over 53% of the U.S. population is going to be clinically obese. It's a problem that we all need to be solving for. We as an organization, in our conversation that we just had, we started off in the Center of Excellence bariatric surgical space. So we have been delivering care to patients with bariatric surgeries for 15 plus years. And we have seen firsthand the struggles of what a fragmented healthcare benefit is sort of creating for the consumer, where let's say you're a patient who has a BMI of a 52. Most bariatric surgeries today, or surgeons in the US, will not operate on a patient unless you have a BMI of a 45 or less. And so what happens to that individual, they're getting bounced back and forth across the fragmented system. You don't qualify for bariatric surgery, go back into the pharmacy benefit. Maybe they're going to reject or approve your treatment. Then you're on that treatment, but your disease management is over here with one of the wonderful, the dozens of hundreds and thousands of cardiometabolic digital health companies, but none of these places are talking to each other. So the disease management company is not talking to the medical carrier, is not talking to the PBM. And then there's a lot of underlying deeply rooted behavioral health issues that are also tied to, right, anxiety and depression and sleep disorders that are causing sort of this underlying issue of obesity, which is a chronic condition. And nobody has quite yet sort of said, how do we take a step back and say, how do we solve for it? Because this problem is getting bigger, not smaller. We have invested in a lot of things like wonderful cures, right? GLP-1 drugs have come into the market, amazing treatments, but how do you get somebody on? How do you get somebody off the drug? How do you get them the support? And we sort of looked at this problem and said, the first place you got to start off with is how do you combine sort of the medical benefit and the pharmacy benefit and the behavioral benefit and the surgical benefit, and you pull it all into one place, which is the one place for weight health. And so because Transcarent has that platform, and because we have the capabilities on surgery and pharmacy and medical care delivery and other elements through local health systems or in the virtual care setting, we can be the place that can surround ourselves and encapsulate the patient or the member along their unique clinical care journey. And it's not just about weight loss, right? It's healthy weight at any size and helping somebody sort of go across that journey without feeling lost, which is sort of where they're at today. So what Transcarent is launching is the one place for weight health that will give several things to an employer and a member. So one platform where they're able to access medication, lifestyle support, behavioral support, medical care, surgical care in one place. the data is all sitting in one place and is seamlessly talking to each other,
Mm-hmm.
to help identify, hey, you've fallen off track, right? You didn't follow your diet regimen. You didn't help support or take your medications properly. You developed side effects. Let's move you here. Or now you've lost enough weight and you qualify for surgery. We have handheld you through the process. That's really what Transcarent is excited about bringing to market. And then ultimately, as you sort of put all of this together, how do we partner with the pharmaceutical industry to ultimately develop a value-based care arrangement, which is so desperately needed in healthcare, to say, we did all the things right. We sent them to the right, highest quality provider. We identified the care. We put them on the drug. It either did work or didn't work. How do we ultimately get there? But you can never get to a value-based care contract unless you're aggregating medical data, pharmacy data, behavioral data, patient self-reported data, all the medical record in a single place. And so that's ultimately what Transcarent is really excited about, and the potential that an offering like this has. And so what's exciting for employers is providing greater affordability, better access, and better management that will ultimately drive to a healthier workforce that is more productive, more happy, and healthy, to contribute to society in a different way. And we're really excited about that.
All right. Bravo. Very excited to hear. I'm sure all our listeners are very excited, encouraged, maybe a couple competitors scared a little bit. But, that's the point. I'm obviously a healthcare nerd. You don't start a digital health podcast if you're not. So let me geek out for a second. Let me condense everything very quickly. Number one, very apparent why, Glenn did call and was like, hey, we need you. Because,
Yeah.
let's look at the two stakeholders here, like you and Glenn, and obviously there are other people on the executive team and the whole company that, are helping with this. But you came from the PBM world. You are a pharmacist. And because of the Evernorth, Express Scripts joint venture, you obviously have a great understanding of how healthcare payers think. Now let's move to Glenn. He took a company in Allscripts, electronic health record company, selling to health systems, worked very closely with some of the biggest health systems in the country. Then he IPO'd that for $4 billion. Then he built Livongo, chronic disease management company. Not only did you guys do diabetes and some weight loss, they also did mental health. They also did hypertension, a couple other things, and took that to a $18.5 billion exit, and now with Transcarent. So now you see all these pieces kind of meshing, where you really bring that PBM, clinical pharmacy, health plan perspective. Glenn brings the digital health, point solution vendor and health system perspective, and you combine those things, that's where some magic can happen. So very exciting, and I really, I'm encouraged just based on your whole leadership team's backgrounds on why you're qualified to do this, and why, if anyone can solve this very, very difficult issue that this whole country is dealing with, I would bet on you guys to be able to do it.
Well, thank you. We're excited. We're ready to take on the challenge, and there's opportunities abound in terms of solving and going back to fixing the issues at hand for the consumers. That is what we're here for.
I love it. Obviously, you and Transcarent as a whole has just, you guys are going for a moonshot, but, it sounds to me like you have the right strategy, you have the right team to do it. Can't wait to watch that. Having said that, you did mention hey, we are going to need a partner other places. We're not going to be able to do everything under the Transcarent brand. So obviously, you already shared what the vision is for Transcarent, and that's a big bite out of the apple. Any other predictions, for 2024 and beyond for the digital health industry? Maybe not as Transcarent specific.
Yeah, I mean, it's really trend driven of what's happening in healthcare today. And there's three key trends that are happening. First one is the need for greater oncology care, right? By 1/1/25, oncology is going to be the number one leading cause of death, number one cost driver. Huge problem, right, that the industry needs to solve for, and we're ready to support employers as part of those offerings. And I'm really excited about, predictions of new treatments, going back to specialty pharmaceutical care and how the oncology sort of landscape evolves, because that is going to be a number one problem that employers are trying to solve for. Second, in terms of obesity care that we just discussed, from a weight health standpoint, we're going to see a tremendous amount of sort of increase in interest, use, and adoption and demand for accessibility of the GLP-1 agents, as well as bariatric surgical care, in terms of how that dilemma needs to get solved for. And then third, musculoskeletal care continues to be a key challenge. And when you really think about, these three things are tightly intertwined, right? Obesity care sort of drives musculoskeletal challenges, bad hips, bad knees, bad backs. You think about oncology care, right? Obesity, once again, tying back to as a key high risk factor for the development of cancer. And so when I think about the Venn diagram of these three things coming together, not just in 24, 25, and 26, we as an industry and employers need to come together to say, how are we going to solve this problem? If the medications, right, are expected to be $100 billion, total addressable market, the musculoskeletal space is huge. The oncology space is really, really large. We have multi-trillion-dollar market just in these three sort of key conditions that need to get addressed and solved. And so I expect to see a lot of innovation, a lot of development from all sectors, from pharma, from health systems, from providers, from point solutions. And that's what I'm most excited about, is that how do we as an industry really rally together and work for the same cause of delivering a better health and care experience for all. So.
Excellent. I'll finish with this. I ask everyone on this podcast, you've got a busy job. Being COO of a company that has the type of ambition that Transcarent has, not an easy job. Also well known, working for Glenn's not easy. He's hard charging. The guy probably sleeps only a couple hours a night. He has a very high standard for hard work. So with you leading alongside of him, what are ways you de-stress? How do you reduce stress? What do you do to kind of exercise and stay in good shape, like mentally and physically, so that you can bring your best self to work, so you can help all these other, millions and millions of people?
Yeah. Yeah. That is so important, right? That mental and physical well-being. You can't be present at your job or any job, in particular in this high speed, high stakes startup space. For me, it's a few things. My family, right? Spending a lot of time with my kids. I have two kids who are in middle school and elementary school, and keeping that sort of balance and that perspective. Having some good laughs, good conversations is always good for the heart and the soul, and just really sort of putting things down and focusing on family. Just even in the last week, coming out of the holiday, taking a few days off, sort of relaxing, refreshing, hitting the new year, and reflecting on what do we need to do in the home and in the work setting, and then obviously focusing on exercise, good health, healthy eating, healthy habits. That is something that I definitely put front and center, because if I'm healthy, if I'm fit, I'm going to be a great mom. I'm going to be a great COO for the company, and that's really important to me. So,
any specific favorite exercises? Like, what's your go-to?
My Peloton.
All right,
I
I
have
love
a
it.
Peloton. Love my Peloton. But obviously, when you have the extra few minutes, you run to the gym, and I travel quite a bit for work too, so that puts a little bit of a challenge. But I say to people all the time, just always be on the move
Yeah,
as much as you can, whether it's just a simple walk or even a simple stretch. Like,
yeah.
get up out of your chair and do a couple of stretches. Jump on a Zoom meeting even 2 minutes late. It will sort of help you and prepare you for the next conversation. So.
Could agree more. I use the Peloton a good amount. I love the app. You can use it for meditation, which I do pretty
Yes.
regularly when I'm on vacation or I'm on like a work trip. You can just like kind of pop it open on your iPad and be able to do like a body weight exercise, class or some
Totally.
stretching or yoga. So it's fantastic. And yeah, my wife, one of her part-time side hustles is she's a yoga instructor. So she gives me some really nice
Love
stretches
it.
to do. So it's super helpful. Any, you're feeding, a couple growing children.
Uh-huh.
Any favorite healthy recipes that you make for your family that, easy, quick, might inspire someone to try something new?
Yeah, I love salads with any kind of protein. We love to experiment with different, especially around the holidays. You've got the Christmas salad. Actually, this Christmas Eve, I made this Christmas salad that you pomegranates, oranges, like different types of oranges, with pistachios and balsamic vinaigrette. It turned out great. It was a huge hit. So just trying different things, and experimenting. But yes, mixing fruits and vegetables in a different way. And then if you want to add some protein to it, that's great too. But yeah.
I love it. That is really, really fantastic. Well, again, Snezana, really appreciate you joining us on the Digital Health Heavyweights podcast. Thank you for stepping into the ring with me. And again, congrats on all your success so far at Transcarent. Really excited to watch you and your company's journey. And can't wait to break this news for everyone in a few weeks.
Thank you so much, Norm. Pleasure to talk to you today. Have a great
Thank
rest
you.
of the week. Thank you.
Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.